Dr. Powell and staff would like to say congratulations on starting your journey to a more beautiful smile. Braces are a big responsibility. Dr. Powell will do his part to getting you to that great smile, but taking care of them is ultimately your responsibility. We will start by discussing how to use the items in the care kit bag you were given today. If you open the kit, you will see a toothbrush with an interproximal brush at the end, floss, floss threader, travel toothbrush, a travel interproximal brush, a timer, wax, a mirror, a sample of ore-based gel, and chapstick. I will first show you a demonstration and discuss how to brush your teeth. The toothbrush in your kit is one designed for use with braces. You will notice it has a groove down the center. This is to help you clean around the brackets. Begin by brushing your teeth in a soft circular motion. Scrubbing can lead to receding gums, so it is important to maintain a gentle hand while brushing. Once you have brushed the surfaces of the teeth, tilt your toothbrush at a 45-degree angle towards your gums and begin brushing your gum line gently. Once your gums are brushed, brush around the lingual side of the teeth or the part of the teeth your tongue touches. On the end is what is called an interproximal or proxy brush. This is used to remove food between brackets and clean the spaces between teeth not easily reached by the toothbrush itself. When flossing, there are two different methods. The first method is a floss threader. The threader resembles a needle. To use, simply place floss through the hole. You may tie or just leave it hanging. Place tip underneath wire, between teeth, push through and pull out of opposite end. Repeat between every tooth. The next flossing option is a floss pick. These are different than regular floss picks as they have flat ends instead of rounded ends. Plackers Ortho Pick is an example of brand for floss picks, but you can use any brand as long as it says on the bag somewhere that is safe to use with braces. To use these, place flat end behind the wire on the edge of the teeth. Push between teeth all the way to the gums and back towards tooth's edge. Repeat between all teeth. Important note, when using floss picks, do not pull the pick towards the wire as this could break a brace off or pull out the wire. The travel toothbrush and travel proxy brush are a great way to maintain proper oral care while you are away from home. Take it with you if you are in school to brush after lunch or spending the night at a friend's house. Next, we will go over how to use the wax in your kit. The wax comes in a small compact. If a bracket is bothering you or rubbing against the inside of your cheek, break off a small piece. Use your fingers to roll it into a small ball and place directly onto the bracket. It will most likely come off when you brush or eat and will not cause any problems if accidentally swallowed. If you ever need more wax, come to the office anytime during operating hours and we will give you more. Our office recommends the use of fluoride rinse to be used at least once a day, preferably at night right before going to bed. This is beneficial in preventing decal. Now we'll go over the key points of the packet that was given to you. No whitening products of any kind. No whitening toothpaste. No Crest whitening strips. No professional whitening. Wait to have your teeth whitened after you get your braces off to avoid brace marks on your teeth after treatment. Brackets do not simply fall off. A significant amount of force has to be applied in order for a bracket to break. The main cause of broken bracket is eating something hard, sticky, or chewy. If you play sports, chewing on mouth guards, or eating sunflower seeds will break brackets. Chewing on fingernails, ice, pencils, pens, or continuously touching your braces will result in broken brackets or bent arch wires. A broken bracket is not considered an emergency. You or your parent will need to call our office so that we are aware of the broken bracket and so we can note it in your chart that it needs to be fixed during your next scheduled appointment. We allow 5 broken brackets. After that, you will be charged a $35 fee for every broken bracket from then on. Continuous broken brackets will slow down your treatment, so be careful. Now flip to the next page. On this page, you will see a list of foods and non-foods that need to be avoided during the remainder of your treatment. Like stated earlier, please avoid foods that are hard, sticky, or chewy, Some examples include Jolly Ranchers, Tootsie Rolls, Laffy Taffies, Starburst, Milk Duds, Caramels, Skittles, Snickers, beef jerky, candy apples, gummy bears, and so on. Avoid chewing on pens, pencils, fingernails, ice, popcorn, nuts, ice cream with frozen candies, etc. You may have gum, but sugar-free, and limit it to one piece at a time. When eating corn on the cob, chicken legs, apples, carrots, etc., cut them into small bite-sized pieces to avoid biting into anything with your front teeth. Use caution when eating chips, crunchy tacos, pizza crust, crunchy cookies, etc. The last page goes over some practical solutions that can be done at home if you experience any issues. Use tweezers to reinsert arch wires that have slipped out of the molar bracket. Wax can be used to cover arch wires that stick out of the molar bracket. Always check for pokey wires before leaving our office. Nail clippers can be used to clip broken arch wires that are poking out if the wax cannot ease your discomfort. Use a pencil eraser to push in the ligature wires that are causing lip or gum irritation. If you play sports, stop by the front desk before you leave today for a mouth guard. Do not use the Bowl and Bite mouth guards as they can break brackets, and remember to avoid chewing on the mouth guard during games or practices. You may become sore this evening, so we advise you to take some Tylenol or ibuprofen. We have some available at the front desk if needed. We also recommend eating something soft, yet filling after you leave, as you may not be up to eating tonight if you get sore. Examples of what to eat include a loaded baked potato, hearty soup, macaroni and cheese, spaghetti, etc. If sore in the morning, smoothies or oatmeal may be a good option for you. This concludes the instructional portion of your visit. The last step is to make your next appointment and get a mouth guard if needed at the front desk. We ask you to make your appointment before you leave today in order to reserve the appointment slot that works best for you and our office. We hope you have a wonderful day, and we look forward to seeing you back at your next appointment.